I was born in the Bronx, and that's where I grew up. I'm the daughter of immigrant parents, and my parents were from Antigua. And I decided to pursue my MD back in the Bronx because I'm a Bronx girl at heart, and I went to Albert Einstein College of Medicine. And I chose to specialize in pediatrics after I finished medical school. And I found that dealing with children really appealed to me. I felt like I could be a role model for them. I felt like teaching them good health habits, just good habits in general. If you started while they were young, then eventually you would have a great population of adults as they got older. When I finished my residency at Montefiore Hospital, my pediatric residency, I took a job with the New York Children's Health Project. They take care of children that live in the homeless shelter system in New York City. And I really wanted to kind of give back to the community that I came from. I think the thing that I love the most about my job is providing good medical care to a population that wouldn't normally have such great care. I felt like dealing with this underserved population, the masters in public health, now that I had the medical knowledge, the masters in public health would make me a more well-rounded provider, and I would be able to see the dilemmas that my patients face from not only the medical angle, but from the public health angle, which I think is very important if you're going to provide them with good care. There are a lot of factors that impact the public health of all the residents living in the Bronx. There is where they live, there is environmental health, there's access to health care and healthy foods. And I think the courses that I took at Lehman taught me to evaluate these parameters, to do a neighborhood evaluation and to see what the people are really up against. It also taught me the importance of data. That if you're going to make a difference in this population, you need to be able to do the research, you need to be able to gather the data, and through that data gathering, you're going to be able to have a better advocacy focus point. This has definitely been a team effort. I could not have done it if my kids weren't behind me, and if my kids weren't able to kind of hold down the house while I decided to pursue this course of study. I think also it provides a good example to my children. You know that if mom can do it, you guys can do it as well. My future goal is to be able to do research, perform research, take a research question and see it through to the end of the analysis of the data, and to be able to get results that I can use as a point of advocacy for my clients and for my patients. I think the way the faculty has taught me to look at data, to look at populations, to look at the factors and the things that impact people's health, I think all of those things definitely have prepared me for my future goals.